Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Arun Kumar M. He is a pediatric endocrinologist and also the adolescent medicine is practicing in Chalvamba in Mysore. He did his MD from Delhi University and then he did his fellowship in endocrinology from Rishikesh AIMS, that is All India Institute of Medical Sciences. And then he worked in AIMS, Delhi, and other hospitals before coming to Mysore. We are happy that you have come to Mysore and treating our children. Welcome, Arun Kumar.
Thank you. Thank you.
Please tell us about this juvenile diabetes and what are the complications.
Yes. As in previous episodes, we have already discussed juvenile diabetes or a pediatric diabetes in children. It is a state of absolute insulin deficiency where the body is not able to make any insulin at all. For that, the treatment option, as we have already discussed, it is the daily injection of the insulin, which is not available inside the body. We have to give from the outside. So, as it is a chronic disease, like it is a lifelong disease, along with the disease, there are few complications which are associated. Like these complications are divided into acute complications and chronic complications. Acute are the ones which happen from the day one. As soon as the patient is diagnosed, started on treatment, it can happen at any point of time. Chronic are the ones which happen over a period of time. So the acute complications, we divide them into hypoglycemia, that is low blood glucose, and hyperglycemia, which is a high blood glucose. In hypoglycemia, that is low blood glucose, usually the blood glucose will fall below 70 milligram per deciliter, which can be manifested in children, like they will feel that sudden anxiousness. They feel there is a sudden palpitations in their heart, and they will have excessive sweating. They show some sudden tantrums. Few children will get headache. Few children will excessive sleepiness. If it is unnoticed, it might go into severe seizures.
Coma.
Seizures and coma.
And
Children
the
can fall
fits,
in.
yeah.
Yes, fits can also, they can also throw that. So this is one of the acute complication, that is hypoglycemia. In hyperglycemia also happens on a day-to-day basis, but that will be controlled with the insulin shots which we give them. Sometimes when it is not controlled with the given insulin, children will land up in a condition called as diabetic ketoacidosis, where because
Okay.
of the excessive blood glucose, the body will start producing acid inside the
Ketone
body,
bodies, yeah.
ketone bodies that will be converted into acid. So children will lead to breathlessness, they will have easy fatigability, then they will fall into coma, they will have severe pain, abdomen, vomiting, and they will be admitted to ICU. So these are the acute
Okay.
complications. So coming to the
Yeah.
chronic complications are the one which happens over a period of time. Usually we say any child with type 1 diabetes over a period of duration of 5 years, we start observing for the complications. Complications happen when there is an increased blood glucose, which causes damage to the small blood vessels inside the body. The minute
Okay.
blood vessels of a size of a
Called
hair,
as the capillaries.
yes,
Capillaries.
capillaries. So
Very tiny
usually
ones.
very tiny ones which are present in the eyes, that is
Hmm.
retina, and they are present in the kidney, and they are present in the central nervous system as well. So
Hmm.
when there is a persistent hyperglycemia for a prolonged period of time, these capillaries will get damaged, which are
Hmm.
the ones which carry blood glucose, oxygen, and nutrients to the vital organs like
Yes.
eye and kidney.
Cells.
So
Hmm.
over a period of time, these cells will keep on dying gradually, and these children will develop problems of the eyes, that is called as diabetic retinopathy, the kidney, that
Hmm.
is called as diabetic nephropathy, and the
Hmm.
smaller nerves, they are called as diabetic neuropathy.
Neuropathy. Okay. Okay. So these are the complications. And what the parents, how to should they make out and when should they bring the child to the doctor?
Yeah, the in the acute complications, the parents will be observing the child whenever they feel that the child is showing those symptoms, as we have already discussed. So they should immediately check the blood glucose. If the blood glucose is less than 70, they have to give the child a glucose powder. Usually it is commercially available as a glucose powder. So they have to take 15 gram, we say it. So usually it comes in a, single spoon, which we use for eating food. In that, for a
Okay.
smaller children up to 5 to 6 years, they can can mix that one spoon of a glucose powder in half glass of water. And for a bigger children and for adults, they can mix 2 spoonful of that glucose powder in half glass of water and make the patient drink. After that, after 15 minutes, we will check the blood glucose again. If the blood glucose has risen, we can give something to eat for them. If it is still low, they can repeat this cycle.
Okay, okay. And if it is higher, they have to give the
If it is
insulin
higher,
and
yes. If they have to give a prescribed amount of insulin. We would have given that from this amount to this amount, you have to give this units of insulin. In case if it is not controlled or the child is having those danger signs of vomiting, pain abdomen, breathlessness, or the child is drowsy, then they will have to bring the child immediately to the hospital.
immediately. Okay. Now, what is the cost of the treatment? Because daily they have to take 3-4 times injections and they have to get the blood sugar. And how much does it cost approximately?
Approximately, if we think for a 10-year child who will weigh around 30 kgs, the cost of each substance will change from place to place. And on a approximate, it will cost around 5 to 6,000 for a child of 10 year, which includes their
Okay.
insulin cartridges, insulin pens, needles, the strips, and few blood investigations they get routinely.
Okay. Now, when we are patients, the children become sick like this and they have to take treatment for the whole life. The parents are terribly worried. What is the hope for them? Are there anything improvements occurring in the treatment and the management? Are they having any hope? Please let us know.
Yeah, previously there was a concept that if diabetes means every time pricking the hand, checking the blood glucose, taking the insulin injection and pricking over the abdomen. That was a concept for diabetes. But now there are a lot of advancements which are happening in the field of diabetes. At present, we have CGMs as previously we have discussed. It is just a coin-shaped disc which will be put over the hand and it will
Yeah,
continuously measure.
understand. Yeah.
Yeah, you don't have to prick every time to check the blood glucose. It will just show in your phone. And for the insulin injection, those syringes, that fear is gone. Now you can just dial over a pen and just put over the abdomen. Children will not get to know that they are taking an injection. And
Okay.
those pens have been so modified that they have become smart pens and they'll be connected
Okay.
to the CGM. And they will,
Okay.
depending on the blood glucose, they will show the amount of insulin to be given. And if you forget
Okay.
to take a insulin, it will give an alarm that you have to take insulin
Okay.
now.
Very
So
nice. Very
so
nice.
there are a lot of advancement in that, and we have insulin pumps. They are called as artificial pancreas, where the insulin pump will be just put. It is just a small box-like thing which will be put over the belt of the child or over the jeans of the child, and it will be continuously connected to the abdomen, where it will be
Okay.
continuously producing the insulin and giving, just like our pancreas. It will be
Oh.
connected to the CGM, and CGM will read the blood glucose and tell the insulin pump that this is the blood glucose level. You have to give this amount of insulin. If blood glucose falls, and the pump will stop giving insulin. If blood glucose rises, the pump will increase the insulin rate.
Oh.
So these are the newer advancement which are seen in this. And there are inhalational insulins like Afreeza.
Oh,
So
I
where the
see.
children can just take like a MDI we give for asthma children, those pumps, they can just put the insulin capsule in that and they can inhale it just before taking food. So the fear of injection, the fear of needles can be taken away from that.
Okay. So, like, you said if the like having a UPS, when current goes, that will give. In the
Yes.
same way, when the pancreas not working, the pump will work. So
Yes.
that's how it is. It is so very wonderful. There is a hope for the children and also the parents that need not be very really worried about it. And
Yes.
thank you very much for explaining so beautifully in such a simple way. Thank you very much, Dr. Arun Kumar.
Thank you, madam. Thank you.